My name is Carly and I'll be your student physical therapist today. And today we have a team of healthcare professionals to work with you over telehealth. So tell me, what brought you in to see us today?
Well, I have this really big wound on my leg and it's not going away and it's starting to get really painful.
Oh, can I see it? And how long has it been like this?
It's been there a while, but it just recently became really painful. And I have a picture on my phone that I can show you.
That'd be great. Oh yeah, that looks really painful. Can you tell me any symptoms you have had or if you'd seen anyone about it?
Yeah, I went to my doctor recently and I had some blood work done and found out that I am high in calcium and phosphorus. And the wound is black and has this purple web-like markings around it.
Can you tell me about your past medical history?
I have a history of vessel disease and I have type 2 diabetes and renal failure, and I go to dialysis once a week for that.
Okay. Based on what I'm seeing with you, I am concerned that it is calciphylaxis. And with this disease, we do not know the exact etiology, but we know it is more common in those with diabetes, renal failure, elevated calcium and phosphorus levels, as well as impaired coagulation. This is a very serious condition, so we recommend you see someone in person right away. But first, I will send you to Margot to talk to you more about this diagnosis.
Hi Nick, I'm Margot, a student physical therapist. I'm going to go with what Carly said and go over some of the physiology of calciphylaxis, and then I have a few questions for you as well. So although the exact physiology is unclear, calciphylaxis can impair your metabolism of calcium, causing deposits in small arterioles. This can eventually lead to blood clots. Blood clots can be a very serious issue, extremely in wound healing. It can deprive the skin and fat tissues of oxygen and nourishment, leading to necrosis. We typically see calciphylaxis in individuals over 50 years of age and more commonly in females. There are some other medications that can also increase your risk. Are you taking any systemic corticosteroids?
No.
Are you on warfarin for coagulation?
Yes, I have hypercoagulability.
All right. And are you on any calcium supplements with phosphate binders?
No.
All right. And then impaired kidney function is also common with this. And this could be from end-stage chronic kidney disease, liver disease, diabetes, and or obesity. Have you been diagnosed with any of these?
Yes, I do have type 2 diabetes and I'm in end-stage renal failure on dialysis.
Okay, that's good to know. People can also have calciphylaxis with normal kidney function. Usually they have other conditions such as cancer, inflammatory bowel disease, primary hyperparathyroidism, protein deficiency, or autoimmune conditions such as lupus. Do you believe you might have any of these?
No.
All right, next we'll have you talk to Phil about some treatment options.
Hello, Nick. How are you doing today?
I'm doing well. How are you, Phil?
I am better than I deserve. So today we're going to talk about medical treatments for your condition, calciphylaxis. And although there are no current treatments available to eradicate your specific condition, the current remedies are basically focused on caring for your skin lesions and treating and preventing your infections, as well as surgical debridement. So that specifically will improve your condition a lot. And then we also want to keep your limbs and the rest of your body as mobile as possible to kind of prevent any deconditioning and just any muscle wasting and things like that.
Okay, so how are you going to care for my wounds? Because I really don't want this to happen again.
Right, not to worry. We are going to keep this wound moist with many layers of dressing, as well as remove any devitalized tissue in order to promote tissue growth. And we will also continue to stress debridement because just to kind of get all the gunk out of there and treat and prevent infections and reinfections.
That sounds great. Is there anything else?
Great question. We will also give you an IV of sodium thiosulfate, which you don't have to know. And this will basically clear your body of any excess calcium, which is causing your calciphylaxis.
All right, thanks, Phil.
Yep, and now I'll take you to Mitch, who will talk to you about any and other considerations for treating in physical therapy.
Hey there, Nick.
Hello.
How's it going?
I'm doing well. How are you?
You know, like Phil said, better than I should be. But, you know, you've kind of heard from other parts of our healthcare team or our SPT clinic about kind of how you treat this disease medically. And, you know, we'll talk more about how physical therapists treat it. But I just kind of want to talk about some odds and ends that don't really fall into either category. Is that okay?
Yeah, that sounds great.
Let me know if I start rambling or if you have any questions. But I'll first just start out with, you know, pain management of this disease. So it's my understanding that, you know, you're in a lot of pain. Is that correct?
Yes, that is correct.
Okay. So I just wanted, you know, to kind of educate you on, you know, maybe where that's coming from and how you can move forward in trying to combat that. So we think with this disorder, it's kind of a two-pronged approach to pain where it's ischemic, meaning blood isn't getting to certain areas of your body, you know, specifically that part of the leg. And also neuropathic, you know, affecting your nerves and the nervous system. So it can be kind of tricky to handle. So I'm sorry you're in so much pain because there is a lot going on there. So I guess my recommendation would be to talk to your primary care provider about using a combination of an opioid and a non-opioid adjuvant to kind of supplement that. So my recommendation would be to ask about, you know, a medicine called oxycodone. And also gabapentin, and that would be that kind of two-pronged approach, the opioid and non-opioid, to try to rein in that pain. So do you have any questions with that? Otherwise, I can give you, you know, or I guess you probably have the contact information for your primary care provider, correct?
Yeah, I'll write that down for my next visit. Thank you.
Awesome. So we got pain there, and then I also wanted to talk to you about nutrition. So a lot of people with calciphylaxis are actually malnourished. You may not think you're malnourished, but a lot of times it has to do with the protein intake of, you know, people. So I might suspect you may be low in protein. So I would recommend maybe talking to a nutritionist, and they can help you kind of set up your diet in a way that you can get that protein to help with wound healing, because it's my understanding you have an open wound, correct?
Correct.
Great. So I think I can give you information for that nutritionist. And then you know, if we get to a point where, you know, you still can't get that protein, we may look at something called a gastric tube or a G-tube, where you kind of, that protein can be kind of put straight into your stomach. But again, the nutritionist can talk to you about that. That's a little out of our scope. And then also I want to talk to you about mental health services. So, you know, if I had to guess, or kind of what I've gathered is that, you know, this is, you know, it's a lot on you, correct? You know, you're carrying a lot. Is that correct?
Yeah, it's been stressful.
Yeah, and I can understand that, you know, this is you know, it's a disease that carries a lot of burden, and for you and your family, you know, people taking care of you. So I would recommend, you know, maybe trying to search out a mental health consultation just to see if they can offer you any sort of services or support in that aspect, just because, you know, again, like, you know, it's a lot to handle, and, you know, we want you to have as much support as possible. So I can give you a resource for a mental health professional, because again, that's out of our scope. And then lastly, there's one more thing I want to talk about, and that is hospice care. I know this can be kind of a heavy topic, but I just wanted to bring it up now, because I've seen in the past hospice care kind of comes too late. So again, I just wanted to put it out there now, put it on your radar. Hopefully it doesn't get to that point. Hopefully we're able to kind of spur this disease, spur the progression. But I wanted to put it on your radar just so it doesn't sneak up on you. And what that hospice care would be, you know, you have that end-stage renal disease, you have this calciphylaxis. You know, those can be two pretty heavy disorders. And I just want to make sure if it were to progress, you're able to be fully supported. So do you have any questions about that? I know it can be kind of tough to talk about, but any questions?
No, thank you for bringing it up. I know it is hard to talk about. I appreciate it.
Yeah, no problem. So then just going back through it, we talked about pain management, nutrition, mental health services, and that hospice care. I can give you the contact info for all those people. Do you have any other questions regarding any of that?
No, thank you.
Okay. Well, thank you for talking to me, Nick. I will pass you along to Sarah, who is our wound care specialist, and then, you can move forward with, debriding that wound and hopefully getting that cleared up as much as possible.
Thank you, Mitchell.
Yeah, no problem.
Hey, Nick. I'm Sarah, your wound care SPT. And based off of what all of my fellow SPTs have talked to you about today, I think it's most important that we go ahead and just schedule an appointment to see me tomorrow to get your wound all cleaned up and dressed appropriately. And also, before you come in, I'd really like for you to get an appointment to see your physician. So that way we can get you proper pain medication so that your pain is managed while you come in, before you come into your PT session, okay?
All right. Sounds great.
Perfect. Well, let's go ahead and set that up then.
All right. Thank you, Sarah.
All right. Thanks.
24 hours later.
Welcome, Nick, to our state-of-the-art SPT wound clinic. Now I assure you that you're in good hands and we are going to help heal your limb. Now I've been informed from your PT referral that you had a telehealth appointment yesterday, and we're informed on your health status. Is that correct?
Yeah, that's correct.
All right. Well, I will be guiding and educating you through our session and future sessions on wound care management. But before we get started, I'd like to get your approval to proceed and answer any lingering questions you may have. Do I have your permission to care for your wound?
Absolutely.
Perfect. Any questions before we proceed?
I'm just a little worried about the pain. I'm concerned it might hurt a little more than I anticipate.
All right. Well, based off of reading your PT referral, it looks like your doctor prescribed pain medication for you to take prior to your wound PT sessions. So did you follow those orders by taking the medication at the specified time before coming in today?
I did.
Oh, awesome. See, that will significantly reduce your pain while I am cleaning up your wound. You may just feel like slight discomfort rather than pain, but don't worry, these procedures are done with care and precision.
Awesome, thanks for letting me know.
All right, well, let's get you cleaned up. I've already prepped my sterile materials on my cart, and I've already suited up in preparation for today's visit. So I'll start by taking a look at your leg to assess the wound. That black dried scab in your wound is dead tissue, or as what we call it, a necrotic eschar cap. And I plan on removing that so it will allow for new granular healing and growing cells to migrate to the wound bed. So it'll look kind of, good bloody red. But overall, it's not too bad. Nothing that I can't handle. We will definitely need to be monitoring the wound along with your diagnosis and management of calciphylaxis in order to prevent reoccurrence of these wounds. So first, I'm going to wipe off your surrounding healthy skin, or peri-wound skin, with an antimicrobial soap and water called HipaCleanse to help in prevention of unwanted bacteria to the wound bed area. Then I'm going to irrigate your wound with sterile saline and gently pat dry with a sterile gauze to prep your eschar cap for removal. All right, so one thing is just please be still. Let me know if you experience any pain or heightened discomfort at this time when I'm removing your eschar cap, okay? You may look at me doing this, or you can look away, but just remember to breathe. Don't hold your breath thinking that it's going to decrease your pain, all right? Okay, here we go. I also see some yellow slough here that I'm going to go ahead and take out of the wound. Looks great. Now that I've removed the bad tissue, it's time to apply the ointment to your wound bed. I'm going to cover with Tegaderm, a silver mesh here, and also it's with a bit of hydrogel. to prevent your wound from drying up. And now it's time to wrap that sucker up. Perfect, Nick. You did great. We're all set with your wound care for today, and I will see you 3 times a week to clean the wound bed and fix out the dressings.
Awesome, thanks, Sarah. Feels pretty good. Thanks for being very informative. Having this diagnosis is a bit unnerving, but my doctor and you have been very reassuring that an appropriate treatment plan will be developed to help control my calciphylaxis.
Great to hear, Nick. The end.